We all have seen these headlines in the recent days that is a new COVID-19 drug has been developed. So let's see what this is. Hello and welcome everyone to our latest presentation on 2-deoxy-D-glucose and adjunctive therapy for treatment in COVID-19. This is a new drug developed in India from DRDO. It is a glucose molecule basically which has this 2-hydroxyl group replaced by hydrogen, so it does not undergo further glycolysis inside the cells. It acts to competitively inhibit the production of glucose 6-phosphate from glucose at phosphoglucoisomerase level, that is a step 2 of glycolysis. It is tolerated at doses of 63 mg per kg per day, and it had side effects, that is QT interval prolongation on high doses. Viral infected cells upregulate their metabolic demand, resulting in high glucose uptake and glycolysis and higher viral replication. This change in metabolic allows selective accumulation of 2-DG in viral infected cells. It inhibits the anabolic intermediates required for viral replication. This schematic diagram shows that there are two glucose in utilization, that is aerobic in presence of oxygen, anaerobic in absence of oxygen. But tumor cells and highly proliferating cells, they have a Warburg effect, that is even if there is oxygen present, there is lactate production, resulting in increased metabolism inside these cells. There is some evidence that apart from this, the 2,3-DG also affects the viral proteins, resulting in misfolding of the viral glycoproteins, resulting in them non-virulent. On the basis of its accumulation of the PET markers, it has been hypothesized that it can accumulate specifically inside the lung cells, suppressing the viral replication. Formulation is that it's available as a powder sachet of 5.85 grams or 2.34 grams. It contains white colored granular powders. The granules are filled with laminates made of glassine paper or low density polyethylene. Storage condition, it has to be stored in 25 degrees centigrade, and excursion should be allowed between 15 to 30 degrees centigrade only. Administration, it has to be administered to patients individualized based on their body weight. It has to be taken orally per mouth in empty stomach, and patients should have some fasting at least 6 hours before they take this medication. Apart from this, 3 hours fasting prior to in the evening is also to be done as far as possible. The take home message is that this is a new drug and the mechanism of action is questionable, especially in a viral disease. It has been tried out in onco patients. We still don't know whether it will actually work in viral infected cells, and we don't know based on the studies that have been available till now how effective it is to use in COVID-19 cases. But considering the fact that if this drug is cheaper and has very low side effect profile, then it can be a useful adjunct to help in reducing the mortality and progression to severe disease, and especially when used along with the already established protocols like with remdesivir or with steroids. Thank you for your patience, and check our website for further information.